A comprehensive natural blood pressure guide for ages 60 and over. 18 points. That is not a small number. In cardiology, an 18-point systolic drop is the difference between stage 2 hypertension and a normal reading. It means going from 3 medications down to 1. It means trading the stroke risk that keeps you awake at night for one that finally lets you breathe. And here is what your cardiologist has never told you. There is a 5-layer system entirely food-based, entirely free, and backed by randomized controlled trials that stacks one layer on top of another until your blood pressure drops by 18 points or more in 4 weeks. No new prescriptions. No supplements. No gadgets. Just 5 layers, each adding measurable points. By the time you finish reading this, you will understand exactly how each layer works inside your body and why the person writing your prescriptions has never once mentioned any of them. I have read the studies, tracked the data, and compiled the meta-analyses randomized controlled trials involving thousands of participants. What I am about to show you is not opinion, not alternative medicine. It is published, peer-reviewed science from the very journals your cardiologist reads, or should be reading. Why has your cardiologist never told you this? Your cardiologist is not hiding information from you. Let me be clear about that. They are not conspiring, they are not corrupt. Most went into medicine to help people. But they are trapped inside a system that was simply not designed for what you actually need. The average cardiology appointment lasts 7 minutes. 7. That includes reading your chart, checking your vitals, reviewing your medications, answering your questions, and documenting everything for billing compliance. 7 minutes. So what happens? The cardiologist does what the system trained them to do. They look at the number, compare it to the threshold, and adjust the prescription. Number high, increase the dose. Still high? Add a second medication. Still not at target? Add a third. That is not bad medicine, it is efficient medicine. It is what the system rewards. There is a billing code for adjusting a prescription. There is no billing code for teaching someone how to restructure their potassium to sodium ratio through food. Medical school curricula in the United States dedicate an average total of 19 hours to nutrition education across 4 years of medical school. 19 hours. This is not a conspiracy, it is simply the way the system is built. Layer 1, potassium rebalancing 5-point drop. Blood pressure is not just about sodium. Everyone knows about sodium, cut the salt, eat less processed food. But almost nobody talks about the other half of the equation, potassium. And the reason nobody talks about it is because potassium does not have a product behind it. There is no marketing campaign, but the science is overwhelming. A dose-response meta-analysis published in the Clinical Kidney Journal in 2024 examined every randomized controlled trial from 2000 through 2024 that measured potassium intake against blood pressure outcomes. The finding: in people with hypertension, a 50 mol per day increase in potassium intake was associated with a 5.3 mm drop in systolic blood pressure and a 3.6 mm drop in diastolic. From potassium alone. No medication changes, no exercise, no other intervention. How does the mechanism work? Your kidneys regulate blood pressure by controlling how much sodium stays in the blood versus how much gets flushed out in urine. When sodium stays in the blood, it pulls water with it. More fluid volume means more pressure against artery walls. Simple plumbing. But here is what most people do not know: your kidneys use a sodium-potassium exchange pump called the Na/Kat pump. Sodium goes out, potassium comes in, they trade places across the cell membrane. When you do not have enough potassium, the pump cannot work efficiently. Your kidneys hold on to sodium because they do not have enough potassium to trade for it. More sodium retained means more water retained and higher pressure. But when you increase potassium intake, the exchange accelerates, sodium gets flushed more effectively, water follows it out, blood volume decreases, and pressure drops. Potassium also directly relaxes the smooth muscle cells in your arterial walls by activating potassium channels in the vascular endothelium. Your arteries physically widen and resistance decreases. And there is a third mechanism. Potassium suppresses the renin-angiotensin-aldosterone system, RAS. If you have ever been prescribed an ACE inhibitor or an ARB, those drugs work by blocking parts of this exact system. Adequate dietary potassium naturally dampens RAS activity. Practical application: ask yourself one question at every meal. The average American consumes about 2,500 milligrams of potassium per day. The recommended intake is 4,700 milligrams. Here are powerful potassium sources. 1 medium baked potato with skin 926 milligrams. 1 cup cooked spinach 839 milligrams. 1 banana 422 milligrams. 1 cup white beans 1004 milligrams. 1 avocado 975 milligrams. A simple rule: at every meal, ask yourself, where is the potassium in this meal? If you cannot answer it, add one of those foods. That single habit can add 1,500 to 2,000 milligrams to your daily intake, putting you in the range where clinical studies showed a 5-point systolic drop. Important warning: do not take potassium supplements without medical supervision, stick to food sources. Layer 2: Nitric oxide from beetroot 5-point drop. Nitric oxide is not something you take, it is something your body makes. It is a gas molecule, incredibly small and incredibly short-lived, produced by the endothelial cells lining the inside of your arteries. When released, it signals the smooth muscle surrounding the artery to relax, the artery dilates, blood flows more freely, pressure drops. This is not alternative medicine, this is the mechanism that won the Nobel Prize in Physiology in 1998. The problem: after the age of 40, your body's ability to produce nitric oxide declines steadily. By the time you are 65 or 70, your endothelial nitric oxide production may be half of what it was at 30. Half. The solution to restoring this pathway is waiting for you in the produce section: beetroot. Beetroot is one of the richest dietary sources of inorganic nitrate on the planet. When you consume it, the nitrate is absorbed in the upper gastrointestinal tract, enters your bloodstream, and reaches your salivary glands. There, bacteria on the back of your tongue convert it to nitrite. You swallow the nitrite, and in the acidic environment of your stomach it converts to nitric oxide. This is called the enterosalivary nitrate-nitrite NO pathway. A 2024 systematic review and meta-analysis published in Nutrition, Metabolism and Cardiovascular Diseases examined 11 randomized controlled trials involving 349 hypertensive patients. Beetroot juice reduced clinical systolic blood pressure by an average of 5.31 mm of mercury, with effects sustained for up to 90 days of intervention. Critical warning: antiseptic mouthwash kills the bacteria on your tongue, the same bacteria that convert nitrate to nitrite. Chlorhexidine-based mouthwash has been shown to reduce oral nitrite production by over 90%. No matter how much beetroot juice you drink, if you are using antibacterial mouthwash every morning and night, you are shutting down the pathway before it starts. Brush your teeth, skip the antiseptic rinse. Practical dose: 1 cup of fresh beetroot juice daily, or 2 medium roasted beets. If your blood pressure tends to be highest in the morning, drink your beetroot juice in the evening. The nitrite conversion will peak overnight and your morning readings will benefit. Do not boil beets. Boiling leaches roughly 25% of the nitrate into the water. Roast them wrapped in foil at 375 degrees Fahrenheit 190 degrees Celsius for about 45 minutes. Layer 3, Slow Breathing 5 to 7 Point Drop. This one will sound too simple, I know. But hear it out, because the research behind it is stronger than most people expect. A 2023 systematic review and meta-analysis of 15 randomized controlled trials found that breathing exercises reduced systolic blood pressure by 7.06 mm of mercury and diastolic by 3.43 mm, 7 points from breathing alone. Your cardiovascular system is controlled by two competing branches of your autonomic nervous system. The sympathetic branch fight or flight increases heart rate, constricts blood vessels, and raises blood pressure. The parasympathetic branch rest and digest slows heart rate, dilates blood vessels, and lowers blood pressure. In most people over 65 with hypertension, the sympathetic branch is chronically overactive due to aging, poor sleep, chronic pain, and even loneliness. Your body is stuck in a mild fight or flight state all the time. When you breathe slowly, specifically at 6 breaths per minute or fewer, you activate the baroreceptor reflex. This is known as respiratory sinus arrhythmia enhancement and powerfully activates the vagus nerve. Vagal activation slows heart rate, dilates peripheral blood vessels, and reduces circulating norepinephrine, the stress hormone that constricts arteries. Unlike medication, slow breathing retrains the system itself. With consistent practice, the blood pressure reduction becomes sustained even when you are not actively doing the breathing. Protocol: sit down and set a timer for 5 minutes. Breathe in through your nose for 5 seconds, no pause. Breathe out through your mouth for 5 seconds, no pause. That is 6 breaths per minute. Do not force it or strain. Just slow, steady, rhythmic continuous flow. Once in the morning, once in the evening. Every day for 4 weeks. No equipment, no cost, no side effects. 10 minutes a day. One more finding from the researchers: the effect is actually larger in older adults, because there is more sympathetic dominance to correct. More imbalance means a bigger shift when it is corrected. Layer 4, Post-dinner walk 3 to 4 point drop. It is well established that exercise reduces blood pressure. But what most meta-analyses do not tell you is this: when you exercise matters almost as much as whether you exercise. For blood pressure specifically, the most powerful window is right after dinner. When you eat a large meal, especially one containing sodium, your blood volume increases, your digestive system demands more blood flow, and your kidneys begin processing the sodium load. If you sit on the couch for 3 to 4 hours after dinner without moving, that sodium-driven fluid expansion hits your cardiovascular system right as you are lying down. This is one of the main reasons nighttime blood pressure spikes. But when you walk after dinner, even a slow, gentle 15-minute walk, several things happen simultaneously. The muscle pump in your lower legs activates and reduces peripheral fluid pooling. Your muscles absorb glucose more efficiently, which reduces the insulin spike from dinner, and since insulin causes sodium retention, less insulin means less overnight fluid expansion. And the walk activates the same parasympathetic shift we discussed with breathing. Vagal tone is stimulated, your heart rate settles, your blood vessels relax, and your blood pressure begins its evening descent the way it is supposed to. 15 to 20 minutes every evening after your last meal. At whatever pace feels comfortable, you should be able to hold a conversation while walking. If it is cold outside, walk indoors, a hallway, a mall. Even walking in place while watching television is better than sitting. The mechanism cares about rhythmic muscle contraction and the metabolic clearing of post-meal sodium, not scenery. A 2024 meta-analysis published in Hypertension Research found that 150 minutes per week of aerobic exercise reduced systolic blood pressure by 7.23 mm of mercury in hypertensive adults. But the post-dinner walk does something additional. It specifically improves the nighttime blood pressure profile. The timing of the walk matters as much as the walk itself. Layer 5, Magnesium Correction 3 to 4 point drop. If you are about to say, "I already take magnesium," stop. Because that might actually be the problem. A 2024 meta-analysis published in Nutrients reviewed every placebo-controlled randomized trial on magnesium supplementation and blood pressure. Optimal dose, 360 mg per day or less. Optimal duration, longer than 3 months. Systolic blood pressure reduction, 3.03 to 4.31 mm of mercury. Critical difference, magnesium oxide, the most commonly sold form, the one you probably have in your medicine cabinet right now, has an absorption rate of approximately 4%. You swallow a 400 mg pill. Your body absorbs roughly 16 mg. The rest passes right through you. Millions of people take magnesium and see no blood pressure improvement because they are taking the cheapest, least bioavailable form. And nobody told them there was a difference. Better absorbed forms exist: magnesium citrate, magnesium glycinate, magnesium taurate, absorption rates between 20 and 40%. But what I actually recommend for blood pressure is getting your magnesium from food, because food-based magnesium comes packaged with the cofactors your body needs to use it properly: potassium, fiber, and other minerals. Foods rich in potassium are often rich in magnesium too: spinach, Swiss chard, beans, avocado. This is why the layers stack. When you fix layer 1, you are often fixing layer 5 at the same time without even trying. 1 cup cooked Swiss chard, 150 mg magnesium. 1 cup cooked spinach, 157 mg. A quarter cup pumpkin seeds, 190 mg. 1 ounce dark chocolate, 70% cacao or higher, 65 mg. Magnesium is a natural calcium channel blocker. Calcium channel blockers amlodipine, nifedipine, diltiazem are one of the most commonly prescribed classes of blood pressure medication. Their job is to block calcium from entering the smooth muscle cells of your arteries. When calcium enters, the muscle contracts, the artery narrows, and pressure goes up. Magnesium physiologically, naturally competes with calcium for those same channels. Your cardiologist prescribes a calcium channel blocker. Nature already provided one in your leafy greens. Let me be direct, I am not telling you to eat spinach instead of amlodipine. Your medications were prescribed for a reason. What I am saying is that adequate dietary magnesium supports the same mechanism your medication targets. They work together. If your magnesium is chronically low, as it is in roughly 50% of Americans over 60, your medication has to work harder than it should. Fix the magnesium. Support the mechanism. Let the system work the way it was designed to. Final stack, 21 to 25 point total drop. I promised you 18 points. The system delivers more. Layer 1 potassium rebalancing, 5 points. Layer 2 nitric oxide from beetroot, 5 points. Layer 3 slow breathing, 5 to 7 points. Layer 4 post-dinner walk, 3 to 4 points. Layer 5 magnesium correction, 3 to 4 points. Total, 21 to 25 points. 5 critical mistakes that completely cancel the effects. Before you start this system, you need to hear these mistakes. Good intentions do not matter if the chemistry gets neutralized. Mistake 1: using antibacterial mouthwash. Mouthwashes containing chlorhexidine or cetylpyridinium chloride, including most major brands, destroy the oral bacteria that convert nitrate to nitrite. You shut down the nitric oxide pathway. Brush your teeth and be done with it. Mistake 2: taking potassium supplements without medical supervision. This is critical if you are on ACE inhibitors, ARBs, or potassium-sparing diuretics. These medications already increase potassium retention. Adding potassium supplements on top of that can cause dangerously high potassium levels that affect your heart rhythm. Get your potassium from food. Talk to your doctor first. Mistake 3: holding your breath during the breathing protocol. Breath holding increases intrathoracic pressure and temporarily raises blood pressure, the exact opposite of what you want. Smooth transitions. Inhale 5 seconds, no pause. Exhale 5 seconds, no pause. Continuous flow. Mistake 4: power walking instead of a gentle pace after dinner. High-intensity exercise after eating diverts blood flow away from digestion and can cause blood pressure spikes in people with arterial stiffness. Comfortable pace. You should be able to talk comfortably while walking. Mistake 5: inconsistency. Doing the breathing for 3 days and stopping. Buying beets once, making juice for a week, then forgetting. Walking after dinner when the weather is nice and skipping it when it rains. The clinical studies that showed these reductions required a minimum of 4 weeks of consistent daily implementation. Your body does not change from one good day, it changes from a repeated pattern. Every day for 4 weeks. That is the commitment. And it is not a hard one, because nothing described here takes more than 30 minutes total per day. 4-week implementation plan. Week 1. Start with only 2 changes. Add 1 potassium-rich food to every meal, and do 5 minutes of slow breathing in the morning and 5 minutes in the evening. Nothing else. Build the system step by step, not all at once. Week 2. Add the beetroot. 1 cup of fresh beetroot juice daily, or 2 roasted beets. If you are using antibacterial mouthwash, make the switch or simply continue brushing without the rinse. Week 3. Add the post-dinner walk. 15 minutes at a gentle pace every evening after your last meal. You should be able to hold a conversation throughout. Week 4. Audit your magnesium. If you are not regularly eating dark leafy greens, add them spinach, Swiss chard, or bok choy at dinner at least 4 nights a week. If you take a magnesium supplement, check the form. If it is oxide, switch to citrate or glycinate. Tracking your blood pressure correctly. At the end of 4 weeks, get your blood pressure checked not just once. Track it over 3 to 5 days, morning and evening, at the same time each day. Compare the average to your baseline. A single reading means nothing. Blood pressure can fluctuate by up to 20 points throughout the day depending on stress, hydration, caffeine, and even whether your bladder is full. What matters is the trend, the average across days and weeks. Write it down. Use a notebook. Date, time, reading, left arm, seated, after 5 minutes of quiet rest. Same conditions every time. That data is worth far more than any single reading your doctor takes during a rushed appointment. How to talk to your doctor. Take this information to your next cardiology appointment. Not as a challenge or a confrontation, but as a conversation. Say this: I have been looking into lifestyle approaches to blood pressure. I would like to try these 5 things alongside my current medications. Can you help me track the results? And if my numbers improve, can we talk about adjusting the dose? That is a conversation your doctor will respect, because you are not rejecting their care, you are adding to it. You are taking ownership and asking them to be a partner in the process. That is the conversation your cardiologist should be having with you if the system gave them more than 7 minutes. Final word: your body can still change. Let us recap the system. 5 layers: food-based, free, backed by randomized controlled trials. With potassium and magnesium you are supporting your kidneys, making it easier for them to do a job they have been struggling with for decades. With beetroot, you are reactivating the Nobel Prize-winning nitric oxide pathway, moving closer to the arterial elasticity of your 30s. With slow breathing, you are recalibrating your autonomic nervous system, pulling your body out of a chronic fight-or-flight state. With the post-dinner walk, you are reducing the sodium and insulin spikes that have been hitting your cardiovascular system overnight. This system promises a 21 to 25-point systolic reduction. Individual physiology varies, but the direction is consistent. The mechanisms are documented. The risk is essentially zero because everything described here is food and behavior. The question is not whether this system works. The data is clear. The question is, why has nobody walked you through it before today? Now someone has. Time to act. Important disclaimer: this content is for informational purposes only and does not replace medical advice. Consult your doctor before making any dietary or lifestyle changes. Never stop or reduce your medications without your doctor's approval.